rural community in the Northwest feels access to healthcare is a luxury rather than a right. Access to quality care is crucial during the coronavirus pandemic, but for some, it's just a dream. Well, Masego, we know we've got this whole issue around the inequalities that exist in the South African context. Let's talk a little bit about this area that you visited and how distant, actually, care facilities are from the community.
Well, Faith, you know, the area I visited is called Mapuputo. It's on the border of Botswana here in the northwest. And really the community there feels as though they've been forgotten, Faith, because care facilities are far from them. So first of all, the nearest clinic to them is about a 45-minute walk. And a lot of them don't have jobs, so they don't have vehicles, and they have to pay something like 700 to get to that clinic. And if you look at a hospital, their closest hospital is the Moses Kotane Hospital, which is now about an hour or an hour 15 minutes drive away. And when they go there, they must pay about 1,800. And for the elderly, that's literally all of their SASSA grant. So I did speak to this community in Mapuputo, Faith, and my colleague Mukhumuti Siduki and I filed this report for you guys so that you can just see. This is the most popular mode of transport here in Mapuputo village. All roads are made of gravel. Mampole Sulebe lives here. In 2006, she caught a lift on a donkey cart on her way to a meeting. She fell off and fractured the bones in her right foot. Her x-rays reveal the screws that had to be put in her foot just so she could walk again. This wasn't an easy journey, because one major problem in this area is that there is no healthcare facility. The nearest clinic is in Mokgoditsane village, a walk of about 45 minutes from Mampo's home. But she needed a hospital more than an hour's drive away.
Painkiller panado aba phonela go spetlele gore ambulance don't die. So in ele phakela ka bo pass 8 ambulance it's a renako it's a kabo 212.
She says there was a mobile clinic here, but since the news of the coronavirus pandemic broke, it's been scarce. The village chief says they've been writing to local government since 2009, begging for a permanent clinic. The nearby Mokgoditsane village clinic's operating hours present another hurdle. It's only open from 9 to 5 p.m. from Monday to Friday. The provincial health department blames financial constraints.
Because we must not plan for facility delivery. Because that on its own is problematic, because facility delivery is too expensive. It's reactive health. And what you need in the rural areas and any other area for that matter, it's strengthening health promotion. That community has a clinic that works for 8 hours, which means it's a call to us to evaluate whether they do deserve to have a 24-hour clinic.
But the community of Mapuputo continues to feel forgotten. Masego Rahlaga, Mapuputo in the northwest.
Well, Masego, just listening to that package that was just played there, the question around whether the community deserves a clinic and also evaluating the health care of the community, and that we shouldn't focus on the delivery of a clinic. That says a mouthful there coming from a health MEC.
Well, Faith, that's exactly what I thought. I mean, his explanation when I asked him about this Mapuputo area, and just to give you a bit of context, Faith, last year, just before the elections, we visited the same area to a grandmother who had been hit by a stroke and couldn't make it to the hospital. She died just a few weeks after we interviewed her. Now we're back to Mapuputo a year later, and they still don't have a care facility in that area. So the MEC telling us that they need to evaluate whether people deserve a healthcare facility or a healthcare facility that operates over 8 hours. This facility that is closest to them, for instance, and I'm sure you heard in the package, is closed on weekends. So basically, it's sort of like the government is saying the people of Mapuputo don't get sick on weekends. So if somebody gets sick on a Saturday or Sunday, that's when now you have to pay that 1,800 rand to ask somebody to quickly drive you to that hospital that is about an hour, 15 minutes away. So that answer from the MEC, when he explained that it's better for people to have primary health care in their communities before they build hospitals, because it's first a clinic that has to take care of you and then you get referred to a hospital. That makes sense. But what about the community of Mapuputo that has no access to a clinic, which is primary health care, and even the access that they do have is 45 minutes away from them in terms of a walk, and on top of that, it's closed on Saturdays and Sundays. That really baffled me, Faith.
Absolutely, it baffles me, and I'm sure there's a story that we'll be following up on quite closely. Masegora Tlhaga, we have to leave it there, but she's giving us the latest in terms of the realities that people are dealing with on the ground. We're speaking particularly here, coming in from the Northwest Province, the community of Mapuputo. Insightful commentary coming in from a health MEC in that area. But it's been 2 months since